In order to prop up Governor Mills' failing narrative of COVID-19 being, quote, deadly and dangerous, the Maine Department of Health and Human Services changed the graph presentation on their COVID-19 reporting webpage late in December to camouflage the relatively benign nature of COVID-19 in Maine, as well as hide the fact that the governor's mandatory face mask mandate, which she ordered on December 11, 2020, has been a complete failure at stopping or even slowing the spread of the respiratory virus that is now known to have a greater than 99.95 to 99.98% survival rate among a vast majority of the public. This is the graph most Mainers were used to seeing throughout 2020 as the Maine DHHS website shows a precipitous and alarming rise in COVID-19, quote, positive cases by displaying the total number of cases to date. Since Governor Mills' mandatory no-exceptions face mask mandate went into effect, the graph began illustrating the ineffectiveness of face masks to stop the spread of the virus. It also showed the extremely low death rate from the virus, so the DHHS chose to change to a daily case number display to soften the appearance of the data. If the old chart was still being populated with data, it would look similar to this one. According to the Maine DHHS, since Governor Mills' mandatory no-exceptions face mask mandate went into effect on December 11, 2020, there have been 20,978 new cases of COVID-19. As of January 22nd, the total cumulative cases for COVID-19 in Maine are 36,598, but the deaths are only at 544 for that same time period. On Maine's COVID scorecard from December 26, 2020 to January 16, 2021, there were 11,679 new cases of COVID-19 in the state, compared to just 42 cases of the normal seasonal flu during the same time period, bringing the total flu cases recorded in Maine to just 89 at the end of week 2. While some people point to the low flu numbers this year and claim that proves face masks and social distancing are working on the flu while COVID-19 is rising because it's so contagious, a look at the historical trends for flu in Maine reveals that the flu seems to go through cycles. During the same time period last year, there were 1,700 cases of seasonal flu in Maine. But the Maine Department of Health and Human Services only recorded a mere 49 cases of seasonal flu, or almost half of the current year's case numbers in 2016. And these low case numbers were happening 5 years ago, when there were no face mask mandates or social distancing requirements among the general public anywhere. COVID-19 continues to be the least cause of death among major causes in Maine. According to data compiled at the U.S. CDC, during the month of December 2020, in Maine, 351 people died from heart disease. 327 died of cancer, 206 died of Alzheimer's, and only 165 died from COVID-19. The COVID-19 deaths in Maine may be skewed, however, since there are reports from family members of deceased individuals that some hospitals were trying to convince them to allow them to mark a death as COVID-19, even if the deceased was negative for COVID-19, in order to allow the family to claim an additional $600 death benefit and perhaps as much money again to the hospital. These stories and more in the print edition of the Fort Fairfield Journal. For WFFJ-TV, I'm Dave DeShant.